Ano nga nilagay yung pangalan na?
Buti na lang, ano ba, nag-bloodletting ba? May dugo?
Apo to.
Ayun nga eh.
Yun ang bit, hindi yung malaki.
Pa, maganda yan pa.
Ah,
Mas maganda to kaysa sa kanila. Don't worry.
sabihin mo
gusto
sa
nila
akin
yung
kung
malaki.
magsisimula na.
Pa, sinimulan ko na pa. Sige. Sinimulan ko na pa.
Video na yan.
Yes, hindi lang, slash lang. Okay?
Nagsimula na ako pa.
Pero pwede na mahaba ito.
Ano? Mahaba. Ano yan?
Hindi, magiging emotional ako.
Sige.
Oo nga eh. Tissue please.
Mahaba
Wag
yan.
na pa.
Nakaiyak tayo.
Upo ako ha, pagod ako sa...
Na kasi ano tayo.
Pwede makahingan sa chair.
To explain it to you why I'm begging you.
Ikot ako dyan. Ikot ako dyan. Ikot ako
Hindi
dyan.
na mauulit. Especially to my grandchildren. Aging 9,
10, 11.
8, 9, and 13. So, I'm going to explain to them ang last process bago nyo ako bigyan ng clearance sa discharge kita. And one thing more, gusto ko magyabang sa apo ko. Dahil sa maging ang pamilya ko, hindi nila alam ito. Ang alam lang nila that I am a minister of the gospel. So, ang trabaho ko scriptural. Yun ang macro side of me. But never na alam nila ang micro side.
Ngayon nyo lang i-reveal.
So, ngayon ko alam.
Eh, si Mrs. Rafaela ba? Alam nyo?
With your permission. With your permission, ngayon ko lang i-reveal. Kaya, this is very crucial in my life. Ito, hindi lang ako minister of the gospel, hindi lang pang-scriptural, kundi meron din mismong microsite na medyo kayabangan na to. Kayabangan na to. Before the declaration of martial law, although I am not a daily authorized member of the bar, pero I appear before the court of law.
Dito yan sa Pilipinas.
Yes.
Okay.
As provided by our civil code, our revised penal code, and revised rules of court. Nag-appear din ako sa Court of Agrarian Regulation. Nag-appear din ako mismo sa Court of Industrial Regulation.
Bakit po?
I have to do it. Dahil sa kailangan i-defense ako ang kapatid sa iglesia na nakakapi. So, they call it pro bono.
No fees.
No fee. Free. Pero awa naman ng Diyos, lahat ng mga cases ko sa Court of Law, sa Agrarian Relation, sa Industrial Relation, at sa criminal cases, lahat naman absuelto. Ngayon,
So, nag-law kayo. Nag-law kayo. Law.
loko.
Nag-law pala.
Loko. Kaya
Pero
yun,
justified naman eh. Sabi niyo
kaya
naman.
kaya yun mismong anak ko, yung bunso, yun ang isa sa inspiration nung siya ay dumalo sa court appearance ko sa Bago City, Negros Occidental. sinabi ng prosecutor, provincial prosecutor, na mag-proceed ka na sa loob. Dahil si father mo, nakita mo naman kung paano siya pakita ng gilas na kanyang diskarte sa court. Walang kalaban na maaari makapagsabi hindi siya mismo duly authorized member of the bar. And one thing more, ang hindi nila alam, na ako'y pwede rin sa medical. Dahil sa ako'y may certificate of attendance conducted by the Philippine National Red Cross hinggil sa first aider. Kaya
Bayad niyo pa ako. Hindi ako just authorized eh. Hindi ako nakaka-attend ng yun eh.
Ng mga
Seminar eh. So,
kaya masabi ko sa aking mga apo na nasa States that their grandpa can also perform first aid
if the needs arises, diba?
in emergency cases.
Sulat na lang baka nagdadalawin pa siya.
In emergency cases. So, as I've said, this is the first and the last occasion to prove to my grandchildren that their grandpa is not only a minister of the gospel, but can also perform some.
Pero yung minister of the gospel, over and above na yun dun sa iba.
Yes, that is.
Hindi yun kaya namin maabot at ng mga lawyer, hindi nila kaya yun. So, that by itself is more than enough achievement.
Okay.
Wala nang tatalo ron. Ultimate yun.
So I'm going to prove to my grandchildren that I can also perform some medical acts in emergency cases. So, Mio, Yuri, King, listen very carefully. Listen attentively. I am about to be discharged from the hospital. Before doing so, the doctor will advise your grandma, your nanay, as to what should be done when I am already an outpatient. An outpatient means that I'm still a patient but no longer in the hospital. So, the cause for being an outpatient because of this wound in my neck. What is the cause of this wound? It was caused by the surgery by the surgeon. I'm not going to explain to you in detail about why it should be done, but I'm going to explain to you in detail about what should be done when I'm already an outpatient. Now, the caregiver or doing the dressing, these are the things that they must prepare. The last process is to be explained properly to the caregiver at home. So, I call this process first. We have the organization. What is meant by organization is that you must know what you are going to do. That is organization. What are you going to do? You're going to dress the wound or the incision made by the surgeon. So, when you have already that in mind as to organization, you know what are you going to do. So, you have to prepare all the things that is needed for the dressing process. What are all these things? It must be properly prepared and arranged orderly. First, you must have the cotton. Second, you must have the this alcohol, the antiseptic. Then, the first thing after organization is the sterilization. What is meant by sterilization? The caregiver should sterilize herself or himself from anything that will jeopardize the patient. Next to sterilization is the application, which is the most crucial point in the process of dressing the wound. Now let's go back to the preparation. After the preparation, you have already all the things that you need in order to perform this dressing. The second is sterilization. The caregiver must wash her hands or his hand with soap and water. After washing with soap and water, he must dry it with a clean towel. After cleaning it or drying it with a clean towel, the next process is to apply an antiseptic or an alcohol. Then dry it naturally. Do not use any object to dry it. Dry it naturally. When it is already dry, the caregiver must put on his surgical mask and must put on his surgical mask. Now, this is the next step, which is very crucial. After putting on your surgical mask and your surgical gloves, the next is to take all the tapes or gauge tenderly A caregiver must always have a tender hands or soft touch. He must not do it he must not do it quickly, but very meticulously. Now, if the wound is already open, let's take for granted that this is the wound. If this is the wound, and you have the cotton, always remember this. We are still in the sterilization process. So, we must start at the center of the wound. Then, move it slowly, either clockwise or counterclockwise. After sterilization, the most crucial point is the application of the medicine. If this is the wound, now is the application of the medicine. The same process in sterilization. You must start at the center of the wound. The same process, either clockwise or counterclockwise. After applying the medicine is the protection. You have to place the gauge or the tape tenderly, as necessary as possible, because caregiver must always have a tender touch. Now, after the protection, when the wound is securely and properly closed, everything is now in order. The next process is the reverse. Gather all your things properly, place it in a secured place properly, and the most important thing, as always, is the policy of any hospital is cleanliness. So, place all your things in a clean place in order to avoid any contamination, in order to avoid any infection. Now that you have done all these things, the next things that must be brought into consideration is to isolate the patient from infection and contamination. This is all what we are going to do. If we are already at home and outside,
the hospital.
But before that, we have to transfuse first the blood. Okay, so you are not yet officially discharged. We still have to do the transfusion. So after the transfusion, then we'll do that, what you explained.
Okay.
Sige.
Is there another thing to be explained to my
Yes, may part
Next
2
thing.
tayo.
Part 2. Recharge natin ta. Recharge muna ta. Thank you.
Mio,
Okay, ha?
Yuri,
Arin.
King,
Ah.
this is my caregiver, my attending physician, Dr. Tom Maningas.
Just one of the 7 doctors that seeing you right now. I'm just one of them. So I think we're about 6 or 7, okay?
The captain of the...
Oh, I'm the attending physician, but more doctors are seeing this patient. Okay? Sige
Thank
po.
you.
Thank you,
very
Doc.
much.
Thank you, Doc.
Small ano lang yung request mo, madali naman.
Thank you, Doc.
Grabe yung request, ha?
Thank you, Doc.
Okay.
Alam ko ang time element ninyo is very important.
Oh, pero
Kaya-
you're more important than my time element. So kung may concern, magsasabi ka lang. Ha? Okay? Sige,
Doc,
ha?
hindi ako makakamay, Doc. Thank you po.
Sige.
Thank you. Thank you. Salamat.